Hi everyone, Dr. Mika here again. If you're new to this channel, welcome. Please click on the subscribe button if you have not already done that. Turn on your bell notification so that whenever I drop videos, you will be notified. Like and share this video, it might be helpful to somebody. Today I'll be discussing a new topic with you known as Myasthenia gravis. Myasthenia gravis is a Latin expression that literally means grave muscle weakness. That perfectly describes the weakness that happens when autoimmune disease affects the skeletal muscles. Individuals with myasthenia gravis would wake up in the morning feeling healthy, feeling fine, and strong like me, but progressively get weaker as the day goes on. They even get weak to the extent that they are unable to perform a repetitive movement. Say, for instance, an individual that has myasthenia gravis is trying to cook in the kitchen. You know, the way you try to chop your vegetables, using the knife to chop your vegetables. As you chop the vegetables on the table, like that, you're making like what is called a repetitive movement. So these individuals are unable to make a repetitive movement. So they're unable to even chop vegetable or even okra. They are very weak and unable to because the muscles are literally weak. So this they are unable to perform anything by the end of the day. So this is how dangerous this myasthenia gravis can be. You know, myasthenia gravis also can affect the extraocular muscles. This is the muscle that helps the eye in the eye movement and the eyelid as well. So individual with myasthenia gravis sometimes also see double vision. Say for instance, I'm holding one pen now. An individual with myasthenia gravis will tell you, oh, this is two pens. So they will see double. They see double vision. They have diplopia. Okay. They also have ptosis or drooping of the eyelid. The eyelid will be drooping. Okay. That is what this myasthenia gravis causes. Myasthenia gravis preferentially affects younger women in their 20s and in their 30s, and older men in their 60s and in their 70s. The cause of this odd age distribution isn't quite clear. To better understand myasthenia gravis, let us review normal muscle contraction, but at a cellular level. First, you've got your motor neurons, which releases neurotransmitter acetylcholine that binds with nicotinic acetylcholine receptors on the muscle cell membrane. So binding of acetylcholine with the receptor would then activate a chain reaction in the muscle cells, which then ultimately results into muscle contraction. But what happened in myasthenia gravis though? Well, remember that it is an autoimmune disease that is specifically categorized as type 2 hypersensitivity that causes cytotoxic injury, meaning that it can can result to lysis or even death of the host cell, which is mediated by autoantibodies that are specific for our own cells or proteins. All right, so in this case, the patient B's inappropriately makes antibodies that binds with nicotinic acetylcholine receptors in the muscle cells. Once acetylcholine receptors are bound by the antibodies, they are unable to bind to acetylcholine, and therefore they are not able to receive contract signal, from the central nervous system. Anti-acetylcholine antibody can also, activate this classical pathway of the complement. The complete system is a family of small size proteins that works in an enzymatic cascade to fight off bacterial infections in the body. The activation of the complement causes inflammation and destruction of the muscle cells and also reduces the amount of acetylcholine uh, receptor on the surface. Minority of people with myasthenia gravis produces a very harmful type of antibodies called muscle-specific receptors tyrosine kinase antibodies, which attack the proteins inside the muscle cells. Myasthenia gravis can also be treated with immunosuppressive drugs like prednisone, which helps to reduce the production of harmful antibodies. Uh, Patients with myasthenia gravis can also undergo surgical removal of the thymus gland, which seems to reduce the muscle weakness symptoms, even in people without identifiable problem with their thymus gland. This is because T helper cells originate from the thymus gland, and it helps to make or produce antibodies for the acetylcholine receptors. All right, a quick review. Myasthenia gravis professionally affects um, younger women in their 20s and in their 30s, and older men in their 60s and in their 70s. Now, myasthenia gravis also affect the extraocular muscles, the muscles that help us in the movement of the eye and also the eyelids. Patients who have myasthenia gravis, they see double vision, diplopia. They have drooping of the eyelid, ptosis. Okay, and again, when antibodies block the receptors, then the muscle will not be able to receive a contractile signal from the central nervous system. And that is why patients are very weak. They cannot perform anything. So it's a very serious type of disease, although very rare, but it's very, very serious because patient can have what is called myasthenic crisis, and that requires an ICU, intensive care unit. I hope you enjoyed this video. If you do, please click on the subscribe button before you go. Turn on your bell notification so that anytime I drop videos, you will be notified. Please share this video, it might be helpful. See you in my next video. Thank you for watching. Atutale.